Well, thanks for joining us. I have Dr. Brianne Grogan right now. She is the founder of FemFusion Fitness. You wrote the book Lady Bits, and you also host a successful podcast and run a great website. So thank you for joining us today.
I'm so happy to be here. Thank you for asking me.
So just tell us a little bit more about your background. I found you by watching some of your YouTube videos because you provide amazing and excellent evidence-based education about pelvic floor education. So tell us a little bit more about what you do and what that is.
Yeah, well, my background is in physical therapy. So I graduated with a doctorate in physical therapy and actually began my career working with geriatric patients in a skilled nursing facility setting. And then I ended up transitioning to focus more on women's health when I became pregnant with my own son. That was kind of the big kind of tipping point to really say, yeah, let's shift gears a little bit. So I transitioned my career to outpatient orthopedics, working with primarily women's health, pelvic floor, PT, but also saw a wide range of clients. And then my family and I got the unexpected news that we needed to move halfway across the world to Europe. So we live in Germany now. And that made it a little bit more challenging for me to work as a regular clinical physical therapist. It's possible, but there were just some extra hoops and some extra legwork, and it was a little more challenging to find a job. And I actually decided that in general, I just wanted to be at home with my son anyway. At the time, he was about 3 when we moved. And so I was content being at home and not working at the time. But then the itch kind of got me, and I ended up moving more into a fitness and wellness realm. I knew that that would be easier for me to do from home and kind of in the setting I was in. I knew that that would be a little easier. So I started a class, a group fitness class. I'd actually started it back in Oregon, where we're from, called FemFusion Fitness. And I brought it to Germany, where we were living. And it really became a success here. And then from there, I transitioned more to YouTube and online work. And it's just really grown from there. It really actually grew, the online work, when I decided to start owning the fact and really celebrating the fact that my focus is pelvic health. When I kind of started, I was really just calling it core fitness, and it was just a drop in the bucket of the world of YouTube. But when I really started honing in and saying, this is all about the pelvic floor, it all starts with the pelvic floor, people started listening, because this is a really, really common issue that people have pelvic floor concerns. And not many people at the time were talking about it very publicly on YouTube. So that's kind of the nutshell version.
I love it. I could just see your transition, because it's similar to mine, just starting out in physical therapy school, getting your doctorate, and then seeing patients, and then from there going online and making that transition to providing education on YouTube. And and like you said, when it comes to pelvic floor, that's a topic that not a lot of people know about. And you help not only women, but men as well. And so I hope that the people listening are going to really see the benefit of hearing you and maybe checking out your YouTube channel and realizing that there are some treatments to be done for any kind of pelvic floor issues as well. So what kind of, basically, could you describe what is the pelvic floor, and what are some common issues that we can start with women? What are some common issues that women might have with the pelvic floor?
Sure. Yeah. And it's funny, because as fellow PTs, it's really not, at least it wasn't a big part of my education focusing in on the pelvic floor. We did, address it briefly in anatomy and physiology. We went through the information about the pelvic floor, but it was kind of glossed over. And so it's not surprising that people don't really know a lot about it. And it's certainly not something that's discussed in general education or, high school health class. People don't usually talk about bladder leakage or pelvic organ prolapse or pain in that area that can cause painful sex and all of those things. Those are all issues that the pelvic floor can contribute to. It can contribute to those issues. And it's unfortunate that we don't talk about pelvic health more openly, because it's actually extremely important in everyday things that everybody does, from going to the bathroom to lifting, can impact your pelvic floor, even to how you hold yourself with your posture. And that's why I'm just so, I don't know, I'm so passionate about sharing this information, because I think that if we gave more of this basic education that's really not even talking about the pelvic floor, you know, posture, lifting, going to the bathroom, you know, all of these things, there's little tips that can keep people safer and can keep their pelvic floor safer for the long run. It can keep it safer for life, but we just don't talk about this stuff. So you'd asked kind of what the pelvic floor is. It's the floor of the core. It's the base of the core. So when most people think of the core, they kind of think of the abs, your abdominal muscles. Maybe people will think of their back as well, kind of the corset that goes around the trunk. But the pelvic floor is really the base of all that. It's the muscles that sit at the base of the pelvis. And they're the beginning of that whole core container that also includes the breathing diaphragm. And you can include hip muscles as well too. There's different people have different definitions, but that trunk of that body, that main corset, does start at the pelvic floor. And I briefly listed some issues that people can experience, such as prolapse, which is when the pelvic organs kind of hang a little low, they descend, and they can push into the vaginal wall, for example. So the bladder can descend and it can push into the vaginal wall. If that happens, prolapse happens when there's a loss of support from the ligaments and structures that hold the organs in place inside, and also when there's a lack of support from the pelvic floor muscles underneath. So kind of that combination, which the perfect storm is usually pregnancy and childbirth for females, although it's not, you know, necessarily, you don't have to have been pregnant or have had a child to experience something like prolapse or bladder leakage. They're actually really, really common issues. About 1 in 3 women will experience bladder leakage, and about 50% of women who've been pregnant will experience at least some level of prolapse.
What are some of the symptoms of somebody that has a prolapse? You said if you have bladder leakage, you don't have to have both. I would assume that you don't have to have both at the same exact time. You don't have to, because you're having bladder leakage, it doesn't necessarily mean you have a prolapse. So what would be what's the characteristic of having a prolapse that would cause somebody to talk to their doctor about that, or see a pelvic floor physical therapist?
Yeah, that's a great question. And yeah, you don't have to have both. You can have one or the other, or you can have both. But specifically, I mean, people know what bladder leakage feels like. And usually we break that up into, for example, stress incontinence, when you're sneezing, coughing, laughing, and you leak a little bit, versus urge incontinence, which is when you have to, all of a sudden you've got to go and you might not make it to the bathroom in time. You're going to leak a little bit. So there's those different types of incontinence, bladder leakage. Prolapse can have bladder leakage as well, but a lot of times one of the main complaints people feel is a feeling of heaviness or pressure in the pelvis. And for females, pressure in the vaginal area. Sometimes people can feel like there's a golf ball kind of in the vagina. So that feeling of just heaviness, pressure, and something in the way is something women often report. The other thing that many women report is back pain. So back pain toward the end of the day, or just pressure toward the end of the day, because they've been standing all day and everything's been pulling down, and that really weighs on them toward the end of the day if they've been on their feet.
What are some of the reasons that might cause these issues? Is it, you mentioned pregnancy, that's probably one of the biggest things for women, maybe potentially older age, like maybe the muscles start to get weaker. But
Yep.
what would cause some of those in women, but then also in males? Well, that's really interesting for me, is for people that might have some of those problems, either with stress or urge incontinence, or maybe sex problems. Maybe they have sexual dysfunctions.
Mm-hmm. Yeah, for sure. And so what can cause it in men or women, but prolapse is more common in women. Men can have rectal prolapse, so they can absolutely have prolapse, but it's something that you hear a lot with among women. And some of the things that can cause it are pregnancy and childbirth. Again, like you said, aging, the tissues change, the makeup of the tissues change. There's a loss of collagen and elastin, so that's going to potentially impact your your pelvic floor as well. So that can contribute. Another thing that can contribute is heavy lifting, repetitive heavy lifting done with improper body mechanics. So if you are lifting and doing a lot of Valsalva maneuver, where you're really, bearing down and you're not supporting from underneath, you're not able to support from the pelvic floor, that can cause problems over time. So it's not going to cause a problem once or twice, but if you've done a lifetime of heavy lifting gardening. I worked with a gardener once. She was a very, very active, fit woman in her probably mid 40s when I saw her. And she'd never had children, but she did have a pretty significant prolapse. And it was because she never learned how to lift and haul and push and pull and do those kinds of things with proper body mechanics. She wasn't, exhaling on exertion. She wasn't engaging her core correctly. And so over time, all of that downward pressure caused a prolapse. Another thing that can cause it is even sit-ups. This is kind of crazy, but doing a lot of really intensive ab work on your back. Now, again, I'm not saying you do a sit-up or you do like sit-ups and crunches are horrible exercises or anything like that. But for some people, probably if they're already a bit susceptible, if they're doing constant crunches, sit-ups, that kind of thing, and they're not properly engaging their core from the pelvic floor on up, and if they're not exhaling at the correct times and managing that intra-abdominal pressure, it can cause a lot of strain and downward force on the pelvic organs, which then can in turn, press down on the pelvic floor and prolapse. So improper exercise, improper lifting, a lot of coughing. So if somebody's a heavy smoker and they do a lot of coughing, all of that downward pressure with each and every cough. And the final thing that I can really think of, there's many things that can contribute, but one big one is constipation. And so chronic straining to go to the bathroom every day. If you're pushing and pushing, then that can really over time cause that downward pressure to increase and cause that drop in the pelvic organs.
There's a lot there. There's so many different, every one of those things that you described, I could just see how there could be so many potential underlying factors with that. Like if you have digestive problems and digestive issues and you're constipated all the time, and then you're always bearing weight. And like you said, increasing that Valsalva pressure, that Valsalva maneuver, which is basically bearing down, kind of like when you cough or when you're trying to go to the bathroom, then that increases that pressure. And then that could exert force on the muscles and cause that prolapse or just weaken the pelvic floor. So yeah, those are so important. What about for the men with some of the sexual dysfunction issues? What kind of issues come from some people might think that some of these issues are maybe related to a lack of blood flow from high blood pressure, but how could we do how could somebody change that with with physical therapy or with exercise?
So one of the biggest things that men often get results from is actually learning how to really, now again, this is totally not a blanket statement. Everyone is so different, and there's many things that can contribute to different male pelvic health problems. Real quick before I go into what I was about to say, prostate cancer and surgeries and issues there can definitely contribute to bladder leakage and incontinence issues and things that working the pelvic floor and learning how to access those muscles can help. And so that's one thing with incontinence and leakage. It can be helpful to learn how to, use the muscles correctly, learn how to coordinate and control the muscles. But in relation to sexual health and also pain, a lot of men come with a lot of tension and pain and excessive tension in the pelvic floor. And I do want to quickly say that females too. I don't want anyone to think that everything I was just saying that we're mostly, female problems is really what I was talking about there with the prolapse and the bladder leakage. It doesn't necessarily mean that the muscles are just, completely lax and all you need to do is work on tightening them up. In some cases, females, and actually in many cases, females are actually excessively tight in the pelvic floor as well. So the muscles just aren't working. They're tight, but they're not strong. Kind of like we always learn about, we've got the short, tight, but they're not necessarily strong muscles, or the long, lax muscles. We want the muscles that go through the full range of motion, that are responsive and resilient and supple. We don't want muscles that are just hanging out tight all day because they're not going to work properly. So that can absolutely happen for females too, and cause really all of those issues I just mentioned. But for men, that's one of the biggest issues we see, is men with a lot of pelvic tension. And so learning how to release and relax the pelvic floor first is the really, really important first step. And that can be done through mindfulness, biofeedback, through mindfulness awareness of the body, relaxation exercises, breathing, and stretches. There's other things you can do as well, but those are some of the ways that I like to work with males. And I do this all by, I have a ton of videos on my YouTube channel, and if anyone's interested, I'm happy to share some information about that.
It's so important. I used to work with people that had spinal cord injury, and some of them would be paraplegics. They would lose so many functions in their lower extremities, including the ability to walk. And oftentimes they would be more concerned about their sexual dysfunction, their sexual health issues, and not being able to enjoy that, compared to actually walking again. So it's really important function for people. And so I'm really glad that you brought it up and that you specialize in it and that you know this so much, because hopefully more people realize that there's things that they can do that are actually, it seems like some of the issues, they're not even, or some of the treatments are maybe not even that complicated. Like you were mentioning about breathing and posture in this, but if we don't know what they are, then how are you going to ever know what to do? So I just wanted to ask about, what are some of the common treatments that people can do to correct these issues? And what are some of the examples of things that you would do?
For sure. And, of course, I'm sure that this is stated by you, at the beginning in the intro, but always talk to a physical therapist in person. And there are physical therapists out there that specialize in pelvic floor therapy, like I was doing when I was practicing clinically, that can see men and women and help you tease out exactly what's going on in the pelvic floor. But I've kind of, over time, since I don't work with people one-on-one anymore, I really work pretty much just online. And so I'm not actually seeing people. I'm not able to examine them and really find out what's going on. So I actually think this is very much a blanket statement. So just know that this is totally a blanket statement. Everyone is different. But I really think the best way to start for everyone, whether you are overly tense or overly, you really need to work on strengthening those muscles, whether they're, loose and lax or overly tense, I think everyone should work first on releasing and letting go and just tuning into where the muscles even are, because they're not. I keep flexing my bicep because we know what a bicep is. We can see it in the mirror. We can feel it with our hands. We know what it is. We can easily turn it on and turn it off. But because the pelvic floor muscles are inside, you can't easily see them. And so they're a lot harder to even feel and to know what you're even doing. And so the first step is learning how to release for men and women. And no matter what your problem is, really. And you can do this. I love having people lie down with their hips up on pillows, which is a really excellent position for prolapse, because it helps kind of pull everything back into place using gravity. So elevate your hips on pillows, relax, release, just tune into the pelvic floor. Do some deep belly breaths down into the pelvic floor, down into the testicle area for men. I mean, that's what they can visualize, down low, down into the perineum. So really, really low. Breathing, and then learning how to exhale and feel it, that lift of the pelvic floor. It's very tiny and gentle, but if you're breathing into your belly and your ribs and expanding, then when you exhale and your belly gently pulls in, you might feel a tiny gentle lift of your pelvic floor as well. So anybody listening right now could try that and see if they can kind of feel that movement with the breath. And that's a nice first step. And then next, it depends on the progression, but I do like to teach people a basic Kegel. Kegel exercises are not the be all end all. They're not all a person should do. And honestly, not everybody should do them, especially right away. If you have too much tension, you need to wait quite a while. You really need to focus on relaxing and letting go first before you dive into the Kegels. But it can be helpful at the very least just to kind of feel, if you can, do a little squeeze and lift of those pelvic floor muscles. And actually, research has shown that the cue of telling people to squeeze and lift their anus is actually a very, very helpful way for males and females, to learn how to kind of access the pelvic floor, but you're not squeezing your butt muscles. So it's kind of like you're trying to stop the passing of gas. And that is a good way to think of it. You can also feel like you're stopping urine. Just sometimes a squeeze and lift is nice, but all of those are ways to just get a feel for if you know how to find those muscles, and then focus really, really strongly on the release, totally letting them go. I like to think of an elevator going up for your contraction, and then an elevator going down, but not just down, going all the way to the basement, and then having the elevator doors open really wide. And that is your full release. So that's the next step. And then from there, we'd add on more core exercises, more strengthening, more function, glute exercises to help balance the pelvic floor. That would be my general progression.
I like all the verbal descriptions, the visuals. It helps somebody connect with the movement that they're trying to do. And that's really good visual. I also like what you said about not just jumping into Kegels right away, because if somebody is trying to find out what to do, I encounter a lot of people that go online, because both you and we put out a lot of educational videos and exercise videos on YouTube. And so somebody might go and start trying some of these exercises and jump right into Kegels and just start contracting. And then they never learn how to relax the muscles, which is so important. And like you said, it's probably important to do this in the beginning and to learn how to relax before you could even start to strengthen. And so, because if you turn the muscles on, you need to know how to turn them off.
Absolutely. And you were asked earlier about sexual health issues. And for men, there's various sexual difficulties that men can have, from, erection issues to ejaculation issues, things like that. For females, they often present with a lot of pain during sex. If their muscles are very tight, it really hurts. They just can't. It just hurts so badly. And so for both cases, again, learning to relax and let go is so key first before you get into the strengthening and the coordination. But a lot of people will go out there and just start researching. Many women especially have come to me with painful sex and saying that they are trying Kegels, and it's just making things worse. And of course it is, because they're already so tight that they can't let anything in. And so learning to release, absolutely key. And really it really can't hurt anyone. And so that's why I think it's, in general, a really good, safe starting place for pretty much everybody.
Yeah, that's really good. It reminds me so much of somebody doing like a squat, for example. Squatting and doing a sit to stand. It's such an important movement, because we need to do that always. We always need to be able to have the independence to get up out of a chair. But if we do too many, if we do too much weight, too many repetitions, then somebody could start complaining of knee pain or some other, back or hip pain. And so, like you're saying, we just need a good starting point. We need to know how to turn those muscles off and then progress them properly. And then get the best outcome that way.
Yeah, for sure.
That's really good. Well, towards the end, I always like to leave the opportunity for you to share a free gift with everybody. So if you have a free gift, or if you have some resources that you want people to check out, feel free to talk about that. I know you mentioned you wrote you wrote a book as well, so you can tell us more about that too.
Yeah, awesome. Thank you for that, first of all. And secondly, I have a book. It's called Lady Bits. So this one is definitely more for the females. It's not going to be as interesting for the men, but it's called Lady Bits, Understand Your Body, Elevate Your Health, and Reclaim Your Spark Naturally. So that's available on Amazon and online locations, Kindle and hard copy form. And then I have a podcast, which is a lot of fun. It's called Dr. Bree Talks Lady Bits. And then my free resource, I'd love for folks to check out my Kegel camp. So I have camps on my YouTube channel. I have an ab camp and I have a Kegel camp, and you can get the first 3 days emailed to you. So it lives on YouTube. You can actually, search for the entire 30 days of Kegel camp on YouTube. But if you want the first 3 days mailed to you, just so it's super easy, that's the free gift that I'd love to give people. And honestly, the first 3 days are really exactly what we talked about. They're that, they're that way to learn how to tune in, learn how to release, learn how to identify. And then very gradually over the 30 days of Kegel camp, we work into the more, functional movements, the progressions, the different types and styles of Kegels, and it's a lot of fun. I'm really proud of the program. It's had great results with folks who've gone through it, and it's for men and women. So if folks want to get the first 3 days emailed to them, there's a link that I'll give to you.
Perfect. I'll go ahead and provide the link to all the listeners, and I'm sure they would love that and learn more about pelvic floor health and sexual health and improving their confidence and not feeling like they're going to have any accidents or any issues. So these were really great tips that you shared with everybody. I appreciate it. I learned a lot. I hope that people listening learned, and they'll check out your YouTube channel and check out your book. And so I want to just thank you for your time and sharing your knowledge with us.
Thank you so much. Really appreciate it.
All right. Appreciate it. Stay safe. Bye-bye.